So welcome everyone. My name is Catalina Vallejos. I'm one of the co-directors for the Health Data Research UK Scotland regional network, and I would like to welcome everyone to one of our webinars that we run roughly monthly on the network. And today I'm very delighted to introduce Rosalie Ashworth and Denise Munro. They are coming from ENRICH Scotland and the Neuroprogressive and Dementia Network. And they are going to talk us about a topic that is really important on health data science, which is about how do we effectively engage with patients and the public in a way that informs the research that we do. And so just a little bit of instructions on the chat. Please be aware that we are recording this webinar and we are hoping to publish this in YouTube. And as you can see in the message there, the names of people will be visible in that recording because of how Teams works. So if you have any concerns, please let us know. So I will ask now Denise or Rosalie to share your slides. And in the meantime, please everyone keep yourself muted during the call, and we will have plenty of time for Q&A at the end. So
I'm just going to confirm that you can all see the slides okay if they shared okay?
Yep, all good.
Fabulous.
We can hear you.
Okay. Thank you very much for inviting us to talk this morning. We really appreciate it. As you've heard, my name's Rosie and I'm the lead for patient and public involvement for ENRICH Scotland and the Neuroprogressive and Dementia Network. And I'm joined by my colleague Denise Munro. And we work together on various patient public involvement groups that we're going to tell you a bit about in terms of the activities that they get up to, and importantly, how we hope to support researchers in getting involved in the groups. So I'm just going to also double check the slides move on correctly. And that's fabulous. Okay, so you're never quite sure with this tech, so worth checking. So as I say, we work for the Neuroprogressive and Dementia Network, which is a very long title, which we have tried to change on a number of occasions, but unfortunately we're stuck with it, which includes people with dementia, with Parkinson's. We also support research in MND, MS, Huntington's. The majority of our network focuses on clinical trials, but we're also involved in other types of research. And mine and Denise's role is very much focused on how we make sure people with lived experience get the opportunity to be involved in the earlier stages of research, in the kind of behind the scenes of research, to make sure that the work that goes on is relevant and meaningful to them. We also support patient and public involvement in ENRICH Scotland, which is an organisation that covers research in care homes across Scotland. We have over 400 care homes signed up as research ready, and that means they're care homes that have agreed to be approached about research. They're not saying they definitely will do research, but they're open to those discussions about research. And our role is then to support, again, that patient and public involvement side of it. So what this looks like in practice, I'm going to let Denise explain the groups briefly and what that looks like in terms of the types of involvement.
But as you'll see there, and from the introduction as well, that we have 3 groups that we work across. Partners in research fall under the arm of the Neuroprogressive and Dementia Network, which we call NDN for short, because as we said, it's a big mouthful. And Rich Voices falls under the ENRICH Scotland, which focuses on care home research. So going back to partners in research, we have 2 groups, a dementia group and a Parkinson's group. The dementia group was really the founding group for partners in research under Rosie, and it's been, I think, 5 years now, or perhaps almost 6, getting up to. So they've had really refined and developed the model for partners in research that has also informed Rich Voices development. We found it worked really well, but we're always refining based on feedback from the group, feedback from researchers, and best practice. So the dementia group, as you can see, has a research input request and co-research and peer-to-peer support. Similarly, Rich Voices follows that same model. Essentially what these are is where the first one, research input requests, where researchers can come and connect with members of the group at any stage of the research, but really often more than not, it's at those early stage, at that ideation stage, design stage, where they're trying to get a bit of feedback on what they're doing and what their plans are, or it may be to recruit members of the group to be co-investigators, co-researchers on the project. And like I said, that is similar for Rich Voices. Parkinson's group is very new. We started last autumn, so we're very much developing our relationship with researchers, our engagement and our visibility with researchers to let them know that we're here as a resource that they can engage with. So we have one meeting a month at the moment where we're focused on building those relationship and visibility, but also starting to feel out ideas that we might like to do for co-research. And that leads me on to the second meeting for the dementia group and Rich Voices, which is that co-research and peer-to-peer support. This allows the group to pursue research interests of their own or engagement interests of their own, co-researchers, co-production of research or engagement. An example of that for the dementia group is a book that they've written on the experience of having dementia, a bit of a support and information and education resource for anyone that's interested to learn about dementia. And they are also currently working on a survey to look at why people get involved in research or not. And that's kind of twofold. It provides opportunity to understand better why people get involved so we can support their involvement better, but also it's allowing the members to be involved from the very start conception of a project, through analysis, through describing those findings, and they're at the analysis stage just now. So this kind of serves as a useful research piece, but also allows the group to develop their and refine their research skills. An example of co-research for the Rich Voices side is that they're looking at a project that's exploring expectations of everyone involved in the care home relationship, so staff, residents and relatives, so that they can better meet and support people, better meet expectations and support people. And that's at the very, very early stages at the moment. So that's still yet developing, but follow our social media pages and you can keep up to date with that. So in summary, that the model is to have input requests where researchers can meet with the group, get that early feedback, where members of the group can do their own research, their own engagement activities. But the foundation of all of this is building and sustaining relationships. Anyone that works in co-production will know how important that is to making a group work well and to sustain it. One of our arms to doing that is, as you can see in the circle there, familiar faces. This is whereby we support new members coming into the group by setting up a little meeting with a current member where they can have a little discussion on what it's like being a member of the group, get questions asked, and also have a familiar face when they do, or if they do decide to join the group. Our Parkinson's, like I said, is a newer group, but building towards this 2 meeting a month model of that works so well for the other groups. I can't slide it. Sorry, Rose, I need to pass back to you to slide.
That's through. Okay. So as Denise was saying, I just thought we'd share some of the outputs that we've been doing as across the patient and public involvement groups. And I think an important reason that we kind of like to consider these outputs is part of how we give back to the group, I suppose, and make sure that the people with lived experience feel that they're getting something from their involvement. They're not just necessarily being asked to do X, Y, and Z for other researchers, but we do really try and make sure that things that they would like to see come out of the group also happen. So one of the examples of this is that we co-created a clinical trial research guide with the Parkinson's group, and that was particularly focused on why somebody may or may not be eligible for a clinical trial, and the kind of coping strategies or reasons why somebody might no longer be able to continue in the trial, to make sure that people had that information there. And that was developed by the group who felt that was experiences that they had that they wanted to try and make sure were better in the future for others. So that's something we've created, and we are planning to go on to create a kind of wider guide then for the different disease areas that the network cover, that all look at how do we support people through that process of clinical trials, particularly because when it comes to patient and public involvement with clinical trials, often when they come to the network, when they kind of come to recruit participants, the protocols and the way things are done are often very standardized and have been agreed and being replicated across different areas, whether it's the UK-wide or internationally. So the amount of the ability to change anything within that in terms of that patient and public involvement is often very limited, depending on the time in which they approach us. So this was about kind of saying we might not be able to shape that aspect of it, but how can we make the experience better for people? We're also, as Denise says, we've been doing a survey with our dementia co-research group. And part of the reason behind that is that when researchers come to them with their ideas, they often struggle to picture what the behind the scenes of research look like. And some of the questions and some of the things that they would raise, but why wouldn't they do it like this? Why wouldn't they look at everything? Why not look at all the possible risk factors of dementia? And part of it was about saying, okay, this is why we need to narrow things down sometimes in order to understand what things are making an impact. And so by taking quite a simplified project, looking at a few questions and saying, this is what the steps of research are when we're doing this, it's helped the group understand why sometimes researchers might say, we're focusing on how A impacts B. And yes, we know there are lots of other factors, but here's why we have to do it this way. And I think that's helped build that trust and understanding of how researchers work with them, which is so important when people come to the group and ask for that advice. As Denise says, one of the other things we did, which one of the first things we did when we kind of developed this group in 2021, over the course of 18 months, we co-wrote a book together. It was 6 people with dementia, 6 carers of people with dementia, and myself writing a book about assumptions of dementia and making sure their lived experience was kind of integrated throughout. And that was a really important part of providing a platform for people to tell their stories so that they felt that they had got something that they wanted to get from this involvement, and then it felt like a more balanced giving back then with researchers because they'd had that opportunity to share their story. And at the moment it's an open access resource, and I checked yesterday and we're at about 28,000 downloads of that in the last few years, which is really, really positive, and I think really validating for the group to see that people want to read that and they want to hear their stories. So that's been really positive. From the care home side, we've also created a short film about research in care homes, as well as creating more images about care homes that we can then use to show a more positive picture of what working in care homes and what research in care homes looks like. And that's often quite a stigmatized image that we have when we think about care homes. We've launched some animations, which I'm going to show you one of those on the next slide. And as Denise said, we've been doing some co-research, which has come from care home managers saying, we have this problem going on in our care home and we'd like to know how we could do that differently. Can you help us develop that into some research that we can do together? So that's what we're in the process of. So it's always trying to find that give and take within patient and public involvement and making sure that that interaction that we have with researchers and that we have in our role is to try and bridge some of those give and take relationships to make sure that people are getting a positive experience and getting things they want out of it while also being able to support researchers. I think that it's going to play the animation immediately, so we'll see. But this is about why it's important to involve people with lived experience.
Everyone's an expert. Involving people with lived experience as co-researchers can make a real difference to academic research and allows everyone involved to feel seen and heard. Effective data underpinned by personal experience can help influence policy and practice. Such involvement helps research be relatable to the real world. You won't always find this stuff in a textbook. These experiences are richer because many people have strong peer networks. In practice, this means they can draw on deeper experiences from these communities. To make a success of co-production, it's important that research is developed in partnership with people with lived experience. As co-researchers, that means developing research with rather than on people. Sure, there's plenty to do to make this approach successful, but get it right and your research will be all the more credible for it.
So that was one of 3 animations that were co-created by our partners in research. And it was about kind of saying, what do you want researchers to know? So they have one animation they made that was about what it's like to be a partner in research, one animation which was about the kind of principles of co-production from their perspective, and that one there that has our lovely Fiona as the voiceover there talking about why it's important for researchers to get involved. And as I think I said at the start of the meeting, the cat turns up in a lot of meetings, and so they insisted the cat was also in the animation. So it's sometimes you've got to go with what they asked to have in there, and we put it in there. But it's been really helpful for that for that to be there, and for them to see again that they've said we'd like to see this, we'd like to share this, and we've been able to create that. In terms of some of the reasons that people get involved, there's a huge aspect of peer-to-peer support within that. Often across the groups, people talk about it being kind of action focused, having that peer-to-peer support, but also feeling like you're achieving something and you're able to take often quite difficult experiences and do something differently with them. And research gives such a fantastic ability to do that. And I think the experience of seeing what kind of research is going on out there and having people come and talk to them about their research makes such a difference, because they start to see how things could change. And I think that's really, really important. So Denise is going to talk a wee bit about what this looks like from the perspective of researchers who would like to get involved with these groups.
Just before I go into that, I noticed on the Q&A about a question on getting the animation shared to you. We absolutely will get those shared to you in the follow-up. A little bit on how we work with researchers. So I touched on a little bit on the model of the groups, kind of ways and way we work. You'll see there we've got co-investigators. Now I mentioned members of the group pursuing their own research interests through doing co-research within their group. This refers to doing co-investigation with researchers who have come to the group and recruited members, and that's why we've got costed into funding proposals there. Members may decide to go and join a project in its entirety and work alongside researchers, co-producing research. One of the comments that I got sharing this event yesterday on social media was, don't just do involvement, do co-research. Not a chance to get back to that, but that's absolutely what we build towards and what we do. That is the ideal that we all work towards, and that we always would recommend. And allowing people to be recruited onto projects, or people choosing to be recruited onto projects, as a way that we facilitate that and support that. And we're always around to support that involvement in co-production as people are working on those projects. While me and Rosie may not individually be involved closely on those projects, we will support our members that are. We also have the Meet the Researcher, or PPI input request, that I mentioned in the third slide there. Now, what this facilitates is that really ideally early involvement or early input into research, where members of our groups can feedback to researchers what's working, what's workable, what's feasible, what's not, what's meaningful, at that ideally very early stage. Now, I did mention researchers may come to these input requests at further stages of their research or engagement plans, but more often than not, it's at those early stages. I've worked with the network for many years in some capacity, but I actually joined fully the network last year, and it's the part that I always shout from the rooftops. I think it's so crucial to facilitate that early involvement. Anyone that works in patient and public involvement will emphasise the importance of involving people as early as possible at that ideation stage, ideally. But it's not always feasible, because building a PPI group requires resources and time, sometimes funding, that's just not always available. Partners in Research ENRICH Voices really meet an unmet need there, to allow researchers who don't have access to a patient and public involvement group to come and meet with partners in research, whether it's in dementia research or Parkinson's research, or Rich Voices who are focused on care home research, to get that early feedback. They'll often go away, make those changes that have been suggested, and they will feedback hugely positively on the changes that they've made. I don't think we've ever had a negative actual feedback. It's always really positive, which is a great joy to Rosie and I. So yeah, this early input is really what's facilitated there. One of my favourite places to see this happening is on all groups, but ENRICH Voices, because care home is quite a unique, environment. Researchers may be coming in to the care home environment having not had much previous care home experience, and you actually see that noted in one of these feedback quotes there. Rich Voices is made up of care home staff, relatives of residents, and other professionals that work in the care home environment. So it's quite a diverse group with lots of different angles that they're coming at. So they can really feed back on what's really feasible on the ground. And we often have researchers come with ideas on how they would like to carry out their research in the care home. And Rich Voices will be like, actually, no, like, you're going to have to change this and that and that and that. But that is to the benefit of the research, because researchers go away, they come back with a research design that's much more feasible on the ground in the care home, is much more grounded in success. Similarly for clinical trials, members' feedback, what's clear, what's jargon loaded, what's not understandable, what's pleasant, what's unpleasant, to make that experience of being involved in research all the better. And that's really what the Parkinson's Clinical Guide is there to support. It also, getting that early feedback on research and that early involvement allows funding applications to be strengthened, because they've often funders want that inclusion from people with lived experience, but it's not always facilitated, as I mentioned, because it takes resources and time to create a group. Partners in Research and ENRICH Voices exist somewhat in perpetuity to support research at those early stages. And as I mentioned, for co-investigating, there is that potential for researchers to recruit members of the group as co-researchers, co-investigators, should they want to. And this gets us on to what we ask of researchers. If anyone here is working in dementia, Parkinson's, or care home research, or similar topics around those, how can you connect with Rich Voices and Partners in Research? First, we'll ask you to put a little lay summary together for the group, so that we can send that to them with a bit of context on what you're hoping to discuss with them. We'll then invite you along to one of those input request meetings to present your project. So this can be, we'd encourage probably less formal, but it can have slides, somewhat formal, or really just an formal discussion. As long as you're providing a format that they can understand and it's inclusive, we can take the conversation from there. We also ask you to come in with a transparency on what you're really asking from the group. Is it just that early kind of consultation and feedback on your design or your idea or what the research needs, or are you asking for further involvement? If you're asking for further involvement, what does that look like? What's the time demand? Things can change, as we know, in research. We should be as transparent as possible so people can make informed decisions on if they want to get involved further or not. And we will also ask you to cost in PPI where you are asking for people's further inclusion, as recommended by NIHR, and ensure that we're following the best practice in people's involvement and rewarding and reimbursing people's involvement. And then finally, we'd ask you on how you would consider how you're going to keep in touch with the groups through feedback. Often, in all participation in research, people aren't fed back on their involvement, aren't given any summary of what's come out of the research, and this happens also in patient public involvement. And it's one thing that members, people with lived experience, feedback as a letdown, really. That's something that is unfortunate. We would encourage researchers to think about how they're going to stay connected, whether it's just feeding back how that initial consultation was, or whether it's feeding back how the longer term project develops and concludes. So we want you to really think about these things early on, and I guess that's our way of encouraging a bit of best practice here as well, and how we should do things. Over to Rosie.
And I'll just add to that, as Denise says, feedback has basically been the thing that's come up across the last 5 years of something that people have really struggled with, the fact they've given their time or they've given their energy to a project and then they've maybe not heard. And one of the things that I think sometimes surprises people is that even if that feedback is, we're still waiting, that's still helpful. People still want to know that. They want to know that, that you're still thinking, oh, these people were involved and we want to update them. And actually, even if it's a bit of a, we know that you've been involved in this, but actually this is when we're expecting to hear from, say, the funder, or this is when we'd expect to have an outcome. I think it helps people feel included, but also it helps give a realistic understanding of the timeframes of research, because we know that things can be clunky and slow, and sometimes those bids aren't successful. And I think sometimes people are maybe a bit hesitant to then share that, but actually it's really important that people know. And I think it's actually quite vindicating when they get frustrated on your behalf that, oh, we thought that was a great project and that's not been funded. And that's, what can we do to make sure that that sort of work is prioritized? So I think being part of that conversation is really important. And I think costing is absolutely a topic that will come up time and time again. It's one that Denise and I also struggle with around how to make sure people are appropriately compensated for their involvement. We've been really fortunate that within our role at the Neuroprogressive and Dementia Network and ENRICH Scotland, the Chief Scientist's Office and our managers have prioritised patient public involvement. So our time is costed to focus on patient and public involvement, which is something that a lot of organisations don't have or don't have costed in. So we're really fortunate that we have that dedicated time for this. And that's what allows us to then support other people to have that involvement with people with lived experience, without some of those additional costs being incurred for them. Because we know that part of the challenge is that often you need that involvement before the funding is in place. So if we can try and support some of that before that funding's in place, then that's obviously makes a big difference. Depending on the level of involvement, we have options for, sometimes there might be vouchers or small pots of money that we do try regularly to tap into. If it's say it's a public in-person event, we might look at whether there's different pots that we can tap into. So recently, when we did the Parkinson's guide, we were fortunately funded by the NHS Lothian Charity Fund to do an in-person event with people with Parkinson's, so that they could look at the kind of draft that they'd created through online meetings, pull it apart and put it back together again. So sometimes it's having those bits costed, but also something that Denise and I have been working on in the background is creating a bit of a template of what that costing looks like. So when you're thinking, oh, we want to put funding in for, say, some of these projects that have PPI or an advisory group, we're able to say, well, this is kind of the costs that you need to think about. This is roughly how much to put into your funding. And similarly, when we think about costing in people with lived experience, one of the things that recently 2 projects that have been funded have done is cost in some of mine and Denise's time, so that you have somebody facilitating that patient and public involvement for your group, but an already established group. So it's removing some of that time of the setup and those additional things. So we also have a kind of draft costing templates for if we were to then put, say, a few hours a week of our time onto that project. And that's a model that seems to be working very well. It's been very successful with Rich Voices. And it's then kind of trying to remove some of that replication of things and those kind of processes that actually we have already established. But we do know that it's a really difficult one. And sometimes funding, there's challenges around whether people want vouchers, whether money will cause challenges around maybe some of the benefits they might be on and things like that. So we absolutely know that can be a challenge. And I think that's where we also try and almost think creatively about what other outputs would people want from that. So when we wrote the book together, the people with dementia and the carers weren't paid for that time. But what we made sure of is in the contracts for the book, they received multiple copies of the book that they could then give out to people. So it's not always the same type of compensation each time. We also try and do things like the small differences of sending thank you cards that are handwritten, sending a tea bag and biscuit for a meeting. Sometimes these smaller things that you can do can make unimaginable amounts of difference, and so it doesn't always have to be that if you can't, say, provide a £25 voucher, sometimes it's those smaller things that make a difference. So it's worth thinking about that, because we do know that there are challenges when it comes to people managing benefits and money and that sort of thing.
Actually, just to echo Rosie's point on tea and biscuits, that we've on projects when we've sent out tea and biscuits for our meetings, a little treat. Maybe it's one of the most positively received items that we get feedback on. And it also promotes just us sitting around having a little cup of tea like we would in the real world, which is really important, I think, for online meetings, just to foster those kind of relationships and take that time. But yeah, tea and biscuits, absolutely recommend for these meetings.
They are surprisingly popular, particularly if you theme them around. If it's a Christmassy meeting, pop some Christmas related treats in. And we did a co-research project with a researcher who was looking at adopting healthy behaviours in carers. So their tea and biscuits were a bit more health food focused, but so it was on theme. But again, it was that aspect of making sure that being part of these meetings is a positive experience, because sometimes that's the main thing. But when we're asking people to support researchers, when we're asking for their time and their energy, we really want the experience of being involved to be a positive experience. And our role is really to make sure that's the case and really facilitate that, because I think that's obviously what keeps people coming back and keeps sustaining this group. And we're so fortunate that our retention of members, but also that kind of bringing in new members and all of that kind of supported space, I think, comes from these gestures and these relationship building. In terms of, again, how similarly to that, how we support groups to work with researchers, we regularly talk to the group about whether there's any training needs that they might have. And some of that is actually more about confidence than anything. How do we build their confidence to talk to researchers about kind of, oh, why do you do it like that? Or could you explain this? I don't quite understand it. And we've definitely seen over the last couple of years that's really shifted for the group, that they're more likely to say, well, why would you ask that question, or why would you word it like that? And let's have a conversation about it. Sometimes we have to do a bit of warning that they might be quite blunt and brutal with it, and it's all done in a as much as possible in it's they're just trying to understand it. As I say, Denise and I are also able to facilitate some of that involvement. So sometimes it might be that when you start a project, we might join for the first couple of meetings to allow that familiar face, us being the familiar face between what they currently do and a new project, just to help them get to know the new researcher if they were going to work on them over a course of time, as opposed to a one-off meeting. And that's just to make sure they feel supported in order to take on that role. We regularly review what information we ask of researchers. So the form that there's a QR code to, and we'll obviously make sure there's links to afterwards. We do keep going through with the group. Are you getting the right information? Do you need any more information from researchers? As that's obviously really important. And we have generally found that the group prefer not to have information before they've met with you. They find it really helpful to have that initial meeting, to have you explain it, to be able to do that back and forth, those question and answers, and then receive the information, because it's contextualized then, it's not so overwhelming, and they know what you want from them. So we often will follow up with here's the questions that you were asked in that meeting. Now feel free to let us know your thoughts, and we collate that feedback. And as Denise said previously, part of the reason we do this co-research is really to make sure they feel that they're able to do topics that are meaningful to them, but also to help them feel more confident to share those opinions and feel able to have that back and forth. And it's been really, really positive to see how much that's grown, while also recognising that we also need sometimes people that haven't necessarily had that much experience in research, because they're going to have a different perspective. So we have a mix of, I would say, kind of established members who've done quite a lot of PPI now, have been quite involved in co-research and PPI, but we're also always bringing in those new voices through things like familiar faces to make sure that we're trying to get as diverse representation as possible. There's always going to be missing voices, and I think it's always really worth noting that. We're always trying to think of the kind of underserved communities that maybe aren't being represented in these groups, and how we can reach out to those communities and find ways to help them be involved in different ways. And I think it's just always worth being mindful of that as much as we can, we're trying to get the lived experience and that be representative. But it also depends on things like tech literacy a lot of the time. It depends whether people have been told that we exist. There's several factors there. But we now have a strategic manager in place whose kind of primary goal is to make sure some of these underserved communities are better represented in research in general. So we obviously work with them closely to see how we can facilitate that. And finally, just thinking about some of the future work, one of the things that comes with working with different organisations is that we're really keen that we don't, for want of a better phrase, tread on people's toes. We're always trying to make sure that what we're doing complements the work of other organisations. And if we can work together with these different organisations, then that's all for the better. I think we're in a really fortunate position that it's not a competition of like, you know, we have this group and you have that group and who can do it better. We're really keen to make sure that if something's already working in one of these other organizations that supports people with lived experience, then how can we help that more? How can we make sure that we're kind of supporting the work they do and vice versa? So for example, with our Parkinson's guide that we co-created, one of the things that we've been working on is we've been working with Parkinson's UK to make sure that we now support one of their research registers, and they now share the Parkinson's guide. They literally this week have agreed to share their Parkinson's guide that we created with all of their members. So it's finding other ways to make sure that as many people as possible get the resources that we know work, while supporting each other. And I think often in research, it's a kind of by its nature, by the nature of funding, by the nature of all these things, that it can be very competitive as an environment. And we're really keen to try and make sure that people feel supported in that, as opposed to creating more silos of information. We support lots of different disease areas. Denise and I are part-time. There's only so much we can do, but we are always keen to think, well, how can we make sure that we meet the needs of the groups and the different areas that we work in. So as Denise said, we started with dementia. We then ended up with a lot of people with Parkinson's involved. So we set up the Parkinson's group. And over time, we hope to make sure that there's representation of these other disease areas. But that might be working closely with those organisations that are already supporting those groups and saying, is there anything you need from us? Can we help you in any way? As opposed to saying, we're now going to set up our own version. So I think that's something that I'm really pleased seems to be working and building through those relationships, and something we want to continue doing, because there's a lot of really good things out there. And I think the more we can work together, the better. Perfect time for me to lose my mouse. There it is. So it's a lot of information. Mainly what we kind of really wanted to get from today and make sure people knew is that we're here, we're available, and our role is to support people to have that PPI involvement and to speak to people with lived experience. And we are very much happy to support you to make that easier. If there's anything you need from us or anything you'd like to know about the group, please do not hesitate to get in touch. We will always do our best to get back to you as soon as we can. We've got various resources, whether it's the outputs from the groups or the input request forms and things like that we can pop into an email so that you have them all. But thank you very much for taking the time to listen today. We really appreciate it. And if there's anything we can do, let us know. And I will stop sharing my screen so that you can see.
Thank you so much to both of you. That was a really interesting session. It's a very important topic that we should all be getting more involved. But as you say, it can be really hard to start, especially for people who come from disciplines like me, from statistics. We don't have the training. We don't really know even who to approach. So we will now have plenty of time for questions. Please do post them on the chat or on the Q&A tab. So just to get started a little bit, in terms of timelines, how far ahead should a researcher plan? For example, if I have an incoming grant, do I need to be looking at months, weeks, days? What are the timelines that you will expect researchers?
That's a really good question. So our Parkinson's group and our Rich Voices group tend to have one meeting a month for these kind of inputs. So you'd always want to be kind of a month ahead of whatever your deadline is as a minimum. The dementia group, because it's more established, has 2 meetings a month. One of those we try to prioritize for those input requests. Generally, we try to say, please avoid last minute if you can, but we also know that life happens and deadlines can creep up and things like that. So as long as we know what those deadlines are, that's the most helpful thing. So if actually you go, look, we've got a really short turnaround and we're just desperate to make sure that people have seen this and things like that. If we know, we'll do everything we can to make sure we can either fit it into a meeting or circulate it so the group have that opportunity to look at it. But I would say ideally plan a kind of month in advance, just so that we know you can fit that next meeting. But we absolutely recognize that might not always be possible. So just keep us posted on that.
Thank you so much. So we have a few questions. So Lidis, if you want, you can either unmute yourself or I can read the question.
That's okay, thank you. You can read it, Catalina, if you'd like to.
Yep. So a couple of questions. So the first one, what do you think makes the PPI work you did co-produce research? And is this a model that others could refer to?
That's a very good question. So I suppose some of it, I would say, is co-research when it's a specific research project. I'd say PPI is the kind of general umbrella for the different activities we do. So when it comes to things like when we co-wrote the book, I'd say it was co-produced, but not co-research because it was about creating the book. Whereas the co-research we do has been from start to finish, the design of the study, the reason for the study, the way we plan to then carry that out. Is all done working with that group. I think a huge part of what distinguishes co-research, I suppose, from more traditional research models is how much control over the way research is done the people with lived experience have. It's not to say that everything is their decision. It's about working together in it. And I suppose our role is to kind of scaffold that. We're bringing the research experience in. My background is in both in co-research and mixed method research in dementia. So our expertise is important there too. And then it's bringing that and saying, well, this is what we might do differently. This is what would work, might not work. So it's about that very transparent discussion about the research process and trying to make sure people are involved as much as they can be. There are absolutely aspects of research that people with lived experience will go, you can do that bit. That's we're not bothered about that bit. So, for example, when it came to going through data cleaning, several of our carers went, yeah, we're not as fussed about doing the data cleaning. Whereas that was something that's, some of those tasks that it's like, yeah, you're right, we don't need to take your energy on that one. That's something that we can do in the background. So it doesn't always mean everything has to be deliberately done by those people. It's just, I think that transparency and that those opportunities are there, and just making sure it's very clear throughout how we do it. I hope that answered the question.
A second part of the question, perhaps you already partially answered, is can you please briefly speak about the research methods that you use and the data analysis?
I can. So there's different studies we're doing. So for the survey, the main method, it was an online survey that we created together in terms of the people with lived experience. It was mainly carers of people with dementia were involved in the wording of the questions, what the questions focused on, how many questions. We did a lot of piloting the question within the group. They tried filling it in a few times. We looked at, are we getting the answers that we want to get? Talking about what a leading question is and why we do certain question options the way we do them, whether they're open-ended, closed-ended, things like that. Comparatively, our Rich Voices group, which is our care home group, the work they're doing around research on expectations and partnership between family members and care home staff. We talked about you could do a survey option, but actually what they felt would be most applicable for their environment was having focus groups or interviews with family members or care home staff. And we talked a lot about, do we do those completely separately? Do we put the groups together? And so the method's been actually having a bit of both and having a layered approach to that kind of mixed method of if somebody would prefer to answer the questions online, there is that option. If they would prefer it to be in a one-to-one scenario, we have that option. If people would prefer to be with other people. So we've done quite a layered approach to that, starting with smaller numbers and then looking to build that out. And that's been possible because of having those people with lived experience kind of saying, actually, this is what we'd do, but actually same questions, but can we do it in another way? So we're always trying to be as flexible as we can with the methods while being quite clear about why we have methods in a certain way. So again, a bit like I was saying earlier, why you can't just say, I want to know what causes dementia. Can we ask every possible question about risk factors? We'll know, because that actually, here's the reasons. We've done a mix of co-analysis in terms of thematic analysis, where we've done group coding of open-ended answers and written answers, and then looking at shared themes, discussing those as a group. We've done some kind of descriptive analysis around multiple people looking at the same data, checking that they would answers the same. So we've done a mix of approaches, all of which is done in collaboration with myself or with Denise, in terms of making sure that people are given the training on the analysis approach, then they do the analysis approach together, and then we look at what comes out of it.
Thank you so much, Rosalie. And there was an ask if you can post a link to the book that you co-created.
Absolutely, we can do that.
I'm pretty sure that you will be very happy
Absolutely.
to that. So a question from Matt now. Are you able to share elements of your funding bits about the inclusion of co-researchers? If I might expand, this might be, like as a starting point, what might this look like? Some exemplars can be quite useful for people thinking to do this.
Absolutely. And I think that's why we've been really keen to create a bit of a template of what kind of activities you'd want to cost in. We try and use things like the NIHR guidelines. They've recently been updated around the different activities and what those costings look like. But we can definitely make sure it's kind of on our to-do list to make sure we have a more publicly available template, because I think it's really hard sometimes to know where to start. So knowing kind of what different costs, what travel costs you might need to put into it, whether it's an online meeting or not, the cost of things like the research packs that we talked about, that putting a tea bag and a biscuit and the printed information, those kind of costings I think can be really helpful for people to have, so that you can then apply for that. So we are going to try and create a bit of a relatively generic template that then people can alter, but depending on their availability, because we know this is something that's missing and would be helpful. So we are working on that one, and we will make sure that we share it with you and get that circulated when it's available.
Thank you so much. Another question from Matt. So when you help develop core researchers, do you have any specific curriculum or training program for them?
For the people with lived experience, or for the researchers doing it? For the people with lived experience?
I imagine yes, but Matt, I defer to you the answer. Yeah, he's nodding.
Yeah. So we've done various bits of training on co-research. Mainly that's been led by myself, just as that's part of my research background. So I've been involved in quite a few research projects now where we've done that kind of initial setup of co-research, where we've then kind of looked at what those individual training needs are. A lot of it is about the accessibility of research language and helping people to understand, create a shared language, I suppose, together. I think one of my very early training on the spot moments was explaining what a bell curve was in an accessible way. And it momentarily threw me, because I was like, oh, I wasn't expecting to go into this level of detail. But over the years, we've developed that kind of, what questions are people asking regularly? What things do we need to focus on? So we do offer some support with that, support with the study setup. If somebody's doing some co-research, some facilitated sessions where we can look at the training needs of the group and of the researcher doing it, because it's still a relatively new concept, particularly in the field of health, in terms of how to navigate some of that. So we continually offer bits of training and bits of kind of adjusting to the needs of the group in that sense.
Thank you so much. And do you use a particular tool to measure your PPI impact, such as Script2 or PERIT?
That's a really good question. And the kind of evaluating the methods of PPI is something that we've been kind of, with all the plate spinning, has been one of those things that in hindsight we wish we'd integrated right from the start, because so many things have been going on. We're actually in the process with one of our projects of looking at what kind of creative methods we can use for evaluation, because a lot of the kind of activities that we're doing, particularly the kind of in-person groups and things, we want to see, if it's, say, people with advanced dementia, we want to think what creative ways of evaluating this do we need to do. So we're actually in the process of pulling together the literature on that in terms of what might be the best option. So it's something that we definitely want to integrate more. It's not something that we have well integrated at the moment, other than the kind of more informal check-ins and more informal kind of ratings of activities by the lived experience group. But we would like to incorporate more of that's relevant to our group, just to be able to demonstrate that kind of impact and know what's working and what isn't working.
Script2, just to add to that, I used a few years ago, and it's a useful framework and keep you on track on what you should be considering. But also, I think just reflection exercises, mutual reflection exercise, group reflection exercises also work really well in PPI, and it kind of follows that in a comfortable, informal way to allow people to speak in ways that are maybe more natural, and allows them to bring their reflections to the forefront. So yeah, just making time for reflection, a reflective session, is a useful way to evaluate.
Absolutely. And one of the things that we did differently this year for the first time is that we have these different groups that work kind of independently of each other, I suppose. And actually we said, well, would you like to all meet together so you can kind of share what you've all been doing and reflect on that together and what works and what doesn't work. And so we did that. We brought everybody together to share the different work and present the different work to each other. And that's something that we're now going to try and do more regularly, just so that people get that opportunity to reflect across the groups and have that shared learning across the different activities.
Thank you so much. So I don't see any other questions on the chat, but there are lots of interesting messages about, all the interest that this has created, and an interesting discussion about how we reward people for getting involved with these types of activities without getting, as you say, problems in terms of benefits and so on. So with this, I think we are going to finish today's session, but I'm very sure that Rosalie and Denise will be really keen to continue the discussion. And as I said, they will be sharing lots of information and links. And as part of the HCR UK Scotland team, we are really keen to share and to help to propagate the voice of initiatives like this and others that might be around in Scotland that we are not aware of. So if anyone also wants to share things, we will be happy to receive that information. So just before we go, just a quick note that we will have our next webinar on the 20th of July. So there will be information going around for the sign up, but yeah, please do join our newsletter if you want to regularly receive information about our events and other events within the network. So with that, Falini, sorry, I cannot pronounce, not sure if I pronounce correctly. Do you want to unmute yourself?
Thank you. Sorry, I wanted to ask a quick question. Are there any opportunities for early career health data researchers, public health graduates to get involved with what you're doing? Because I'm at the point in my career where I'm trying to really understand lived experiences. I got an opportunity to create an audio podcast for the Aberdeen Maternity and Neonatal Data Bank to just inform the pregnant women in the community on the importance of their health data and the global impact that maternity and neonatal data is having in not just in Aberdeen or in Scotland, but like the influence it's making worldwide. So I just wanted to know if there are any ways to be part of what you're doing.
Absolutely. So the groups are open to everybody. We're very much because particularly as clinical research often has quite strict criteria, we try and make sure that it's open to anybody who'd like to come along and learn from and be part of the group. But also we've had experience co-creating a podcast. That's something Denise has had a lot of experience in. So if you'd like to have a kind of meeting with us to learn a bit more about that as a process, we can set that up. Just get in touch and we can have a chat about what that looked like for us.
That's amazing. Thank you so much.
No problem at all. Thank you so much for all the questions and for joining us and hearing us out.
Thank you so much. And
yeah,
we will collate all the information and circulate to the attendees. So thanks again. Really interesting session. I just wanted to give you another online clap. Thank you.
Thank you so much.
Bye, Thank you so much for having us. Bye-bye.
Thank you.
Bye.
Thank you.
Bye. Bye-bye.
Bye.